Hi, everybody. Nancy A. here from Professional Movement Solutions. Welcome to members of the Living Well Academy. Today, I want to feature an exercise that I do routinely in my Buff Bones classes that has got some subtleties to it. And it's all about intent and what this exercise is meant to do. And I want to share with you some uh, different viewpoints, if you will, of how to do this correctly. It's hard to do. It's hard to do. It's a small movement, but again, the intent is so specific that it's worth exploring and knowing more about it. So the exercise in Buff Bones is called Wag the Tail. It's hiking a hip. It's hiking a hip. Not that easy to do. I actually have to practice it a little bit. But when we wag our tail, if you notice, my shoulders are still, my legs are moving just a little bit, but even if I don't move them, there's out one direction and there's out another direction. You may have more movement than me. Most do in this regard. Okay. But it's not like this, right? See how the shoulders tipped and see how the whole trunk moved. Think of the rib cage staying upright. Okay. So you don't want to do this. It's just that. It's a hip hike. Think of the pelvic rim here, just hiking it up a little bit and down, and then the other and down. Okay. So that's what it looks like standing. Sometimes we will do that standing with knees slightly bent. I'll show it from behind. I think it'd be worthwhile. Knees slightly bent, and then your hips to the right, and then back to center, and then the left and center. Okay. So that's what it can look like there. On the mat, if I were to show it to you here, be cognizant of what's happening on this side of me, right? So gaze to the mat. And here, what we're going to do is just shift hips to the right and then center. Always pause at the center and then the left and center. Right, center, left, and center. And relax and relax. So why does this matter? This exercise works a specific muscle, big name, quadratus lumborum. It's your hip hiker muscle. You can think of it that way. It attaches from your spine to your pelvic rim here. And it literally, when it contracts, it brings that rim up. And then when it relaxes, back down. The quadratus lumborum is very, very important to keep strong in terms of any low back pain and history of it, etc. That is the reason why we do it. Okay. And so there's subtleties to this. Take a look at this video over and over again if you need to, especially if you're in my classes, so that you can see what I'm talking about. So again, if I just kind of move away, the blue on white is good to do this here. So it's just a little out and then back to center, that, and back to center. So the shoulders are staying level, right? If you're on the wall, the arms are staying level, the ribs staying level and straight up and down. Okay. So give it a try. Let me know how it's going. Okay. And keep moving.